Hi, this is Dr. Esposito from All Creatures Animal Hospital. And today I have an assistant here, Mackenzie, who's going to ask some questions that I'll answer on some of our cardiac issues that we may see in our feline patients. Mackenzie, what's your first question you have?
Dr. Esposito, what is the most common heart disease in cats?
So our cats, most typically we see HCM, which is hypertrophic cardiomyopathy. That's probably makes up about 60% of our cardiac cases for our kitty cats.
What are the signs and symptoms of heart disease in cats?
So it's variable. Some of our cats don't show any symptoms at all. So they're asymptomatic. Other cats could be clinically in distress, so they could have respiratory issues where they're open mouth breathing. They can present with hind limb paralysis due to blood clots secondary to heart disease. So it could be quite variable.
How is heart disease diagnosed in cats?
So for our cats, there's several ways that we can diagnose heart disease. For sure, the most diagnostic and definitive would be a cardiac workup, which would include thoracic radiographs, ECG, blood pressure, and an echocardiogram.
What types of tests are used to evaluate a cat's heart health?
So echocardiogram is by far the more definitive diagnostics that we can use to determine the cardiac health of our feline patients. There are some blood tests out there too that may be used for some screening ahead of time, but they are not as definitive as our echoes.
How can I tell if my cat is at risk for heart disease?
Well, some of our cats are more predisposed to cardiac disease. In particular, like our Maine Coons, our Ragdolls, some of our Bengals can be more predisposed. So breed disposition is certainly one of them. Otherwise, diagnostically, some of the screening blood tests, pro-BNP is one of them that we may use to help maybe with an annual exam. We could run that to see. Also check in blood pressure. Blood pressure can also contribute to our cat's cardiac health, and also another endocrine disease that's out there that can contribute to cardiac disease is hyperthyroidism, and hyperthyroidism is fairly common in our cats, so these could all be screening tools to check and offset or be preventative to helping our cats prevent cardiac disease down the road.
What treatments are available for cats with heart disease?
So the treatments will be consistent with their symptoms and or the findings on the diagnostic test. So it could be if they're asymptomatic and the diagnostics show that they're in an early stage of heart disease, it may just be to recheck the cardiac workup on annual basis or every 6 months. If they are symptomatic, then it will be based on the symptoms and the diagnostics of what is found to be the problem with the heart. And that could be blood pressure medication, it could be anticoagulants, it could be medication to keep fluid off the lungs, like a diuretic.
Can heart disease be cured, or is it a lifelong condition?
So for most of our cats, it is a lifelong condition that we manage, and many of them we manage well. So it'll depend on what we find with the diagnostics.
What dietary changes should I consider for a cat with heart disease?
So again, these are very broad questions. It depends on if they're symptomatic and what the diagnostics show to be the problem with the heart disease. It may be just maintain them on their regular diet all the way to cardiac diets that are lower in sodium.
How often should my cat have checkups if they have heart disease?
So our cats with checkups, if they've been asymptomatic and we are just watching them, generally we'll recommend rechecking a cardiac workup every 6 to 12 months to follow the progress of it and intervene as soon as possible when things start changing. If we've got a symptomatic cat, say a cat that has already presented with congestive heart failure and or a blood clot that has caused other issues, and then certainly the recommendations would be changing and most likely more recent than 6 months. We would probably want to do it every 2 to 3 months. Once they're stable, recommendations tend to change and maybe lengthen out how often we need to recheck them.
How can I recognize an emergency situation related to my cat's heart condition?
Typically, our cats that have an emergency related to their heart health will present in a couple ways. A lot of times they become respiratory distress, so they're having difficulty breathing, open mouth breathing. They usually go off their food, they become anorexic. They may be coughing, gagging, vomiting. And certainly they may present if they throw a blood clot. They often throw the blood clot towards their hind limbs, and sometimes they'll become paralyzed in their hind limbs and very painful. So if there's any of these signs, I would recommend emergency urgent care immediately.
What is a normal cat heart rate, and what should I do if my cat's heart rate is elevated?
So our cats typically have fast heart rates. We would imagine a normal heart rate for a cat that comes into the office to be between probably 120 and 180. But if the heart rate is over 200, that's elevated, and we should look into that further.
Is heart disease a reason for putting a cat down?
It'll depend on the signs and symptoms when they present, and the diagnostics that are done and what's found. Truly, it would depend on how they respond to treatment as well. Many cats will show up in very much distress, and we can intervene with medication and supportive care, and they respond wonderfully. And if they respond, in such a positive manner, we often can maintain them for many months to a couple years, doing very well. So cardiac disease by itself is not a reason to euthanize a feline patient. Now, if there's a lack of response and or they present in such a condition that extending their life or saving them doesn't seem like that would be successful, then maybe we would consider that at that time. As always, this is just a general overview for our feline patients with some cardiac disease. We are happy to answer questions anytime, so if you have any questions about cardiac disease in your feline patient or your cat that's at home, please give us a call here at All Creatures Animal Hospital.